Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
Good afternoon.
Good. Today we're going to be talking about the pros and cons of using a manual toothbrush versus an electric toothbrush. This is kind of a really big question. I feel like a lot of people need to know the answer. I want to know the answer.
Yeah. Dental anxiety, right?
Yes.
Didn't you just say that which toothbrush? I'm kind of nervous to even find out if I'm doing the right thing or the wrong thing.
I am. Yeah. I don't know.
Here's the funny part. It's not funny. It's ironic, I guess. We're dentists and hygienists. You go and get your teeth cleaned, and the hygienist says, this is the toothbrush you should use. Okay. How do you use it? We never tell you how to use it. And then we say things like, how about getting an electric toothbrush?
Yeah.
Never show you how to use it. So today's here to talk a little bit about it. We're not going to get too detailed, but most of the time, the toothbrushes that you see up on the screen, the one on the left, the green one, is your manual toothbrush. We want soft. Not medium, not hard. They're all listed. All the drugstores sell hard, medium, soft, extra soft.
Really?
For adults, you want a 3 or 4 row. So if you look at the toothbrush, there's 4 rows, and it's either rounded or diamond shaped or rectangular. That's fine. And then on the right side, you have, in this case, it's a spinning brush that is electronic. And there's different electronic toothbrushes. So if you press too hard, it stops. If you press, or if you're not timing yourself, it'll shut off when you're supposed to. Or if you shut, yeah, it kind of gives you a nice positive feedback if you're doing the right things. The pros with the electric toothbrush is, or mechanical we'll call it, is that it does clean the plaque 10 times better than manual.
Wow.
All right. The research shows that if you use a traditional toothbrush, as long as you use it properly, you should be removing plaque and flossing. The con for the electric toothbrush is it costs more.
Yeah.
But we know if you use an electric toothbrush that cleans the plaque 10 times better than the traditional means, but it costs more, you're actually going to save yourself more because you're going to eliminate the plaques that cause the gum disease and the cavities.
So it's worth the investment.
Yeah, but patients want what they want.
Yeah.
And if you're lucky and you're young like yourself and you're using a traditional toothbrush and you're doing soft brushing, not wearing down your gums, you're not bleeding because you're flossing a little bit, traditional's fine. But you need to be instructed on how to use it properly.
On how to use it properly.
Right.
So that's something you can ask your dentist too if they're not going to offer it up and tell you right away. You can ask them, how do I use my toothbrush?
Right, it's called oral hygiene instruction. That's the job of the hygienist. And if the hygienist is doing it, the doctor should say, hey, do you know how to use this stuff?
Yeah.
Do you know how to floss?
Yeah.
Not really. I had my son this morning. Dad, I don't really know. He's 15. I have a hard time getting those back teeth. Can you show me?
How to floss.
I'm your dad. I'm a dentist. I think I can do that. So,
yeah.
Sure.
So with the manual or the mechanical toothbrushes, do you also get to choose like the bristle, like if it's hard, soft, medium, same thing?
They're usually geared towards soft because if you have a mechanical toothbrush and you're normally used to working a traditional toothbrush, then you increase it with an electrical or electric toothbrush and it's spinning, you potentially could do more damage to your teeth.
Wow, didn't even think about that.
Or your gums.
So they usually go on the softer side.
They're going to be on the softer side where the traditional means you can see they're always marked H, M, S, X, S.
Wow. I didn't even know that.
Yes.
So my last question for you is, how often should you replace your toothbrush, be it manual or mechanical? The toothbrush head, I know you're supposed to kind of replace it every so often to be healthy.
Yeah, let's talk about that. Everyone's different because you brush a little harder. And in a lot of cases, if you're traditional, maybe 2 toothbrushes. Please, if you leave your toothbrush on the sink and it's next to your potty, move it. Because every time you flush, bacteria go in the air. It's on your toothbrush, you put it in your mouth. Not good.
Not good.
So at least put it someplace or put it in the cabinet, close it, drawer, whatever. We usually give a toothbrush, not usually, we always give a toothbrush every 6 months or every cleaning. And it just depends on you. If you're doing a lot of brushing, you're brushing 3, 4, 5 times a day, your toothbrush is going to wear out.
Yeah.
I think realistically at about 13 weeks, which is a little more than 3 months, probably a good idea to switch it out. Get 2. Most doctors' offices give you, if you ask for an additional toothbrush, it's not a big deal.
No big deal.
Yeah.
Well, that's really good because brushing your teeth is such a key piece to preventative dentistry, to making sure that you stay hygienic orally and to make sure that things are healthy, right?
100%. 100%.
Yeah. All right. So to schedule an appointment with Dr. Bilski, you can go online to bilskidds.com. Thank you so much for talking with us about these toothbrushes today.
Good to see you.
Good to see you too.